Coronavirus is the hot topic these days. Yet there is something nobody has talked about. How does the Chinese healthcare system work? Here on VisualPolitik, we've talked about how China reacted to the pandemic, but now we want to focus on how their healthcare system may or may not play a role in this. After watching this video, you will understand a fundamental piece in this whole puzzle, so let's get started. Here is the question we will all be asking in 30 years. Where were you during the coronavirus crisis? And I'm sure we will all remember pictures like this. Yes, we've all seen those news stories about China sending aid to European countries. Some media outlets are even praising China for how they did what was needed in order to contain the infections. Nevertheless, there is something we still need to know. How does China's healthcare system work? Could the coronavirus become the Chinese Chernobyl? China has been characterized by very low-level, if non-existent, health regulations. If you traveled to China, you might have seen the wet markets where food is handled without gloves and there are hardly any hygiene controls. This is why we started researching more about their hospitals and their healthcare. Is it private? Is it state-sponsored? How does it work? And, well, this video is probably going to blow your mind a bit. So now the question is, does China deserve such a bad reputation for their healthcare system? Why is it that so many Chinese people don't want to visit the doctor? And the most important question of all, does the Chinese Communist Party have some responsibility for the spread of this disease? And yes, we're going to answer all of those questions, but before we do, it's time to talk about health, so we're going to be joined by Dr. Amjad Radwan, who has a wonderful channel about health in Spanish called Globulo Azul. And by the way, if you sprechen Sie Deutsch, we've now got VisualPolitik in German, so I'm going to link to that below. Do go check it out if you speak German.
An arm and a leg.
In 1949, Mao Zedong rose to power in China. He found a vast country that seemed frozen in time. In most of the Chinese villages, talking about modern medicine was like talking about the internet. So having no budget to train the required doctors, he came up with a creative solution, the so-called barefoot doctors. The success of barefoot doctors was its expansiveness. The program reached 90% of China. The medical knowledge was not profound, but it provided three basic services: attending childbirth, which reduced infant mortality, carrying out wide-scale vaccinations, which was vital for preventing infectious diseases, and improving information on the basic hygiene habits of the population, which went a long way in preventing potential epidemics. And yes, I know what you're probably dying to know. Simon, did they really not wear any shoes? Well, no, they totally did have shoes, but they were in the countryside, so if they wanted to attend to someone in the rice paddies, well, they'd have to take their shoes off if they wanted them to last until the next 5-year plan. But during the 1980s and 90s, these barefoot doctors became outdated. The country was growing fast and the people prospered. Everything was good except two things: the environment and healthcare.
China healthcare costs, forcing patients into crippling debt. Fortune.
Think about it. The modern market-friendly China wanted modern hospitals. Those barefoot doctors sounded like a thing of the past, and the quickest way to get those modern hospitals was through a private system. The existing health system was eventually privatized. China's new economic policy required that Chinese people make money, lots of money, enough to pay their medical bills. In other words, they wanted to move from a system of equally poor to, hey, wouldn't it be better to all be rich? China's economic growth in these decades is evident. The problem is the usual one: inequality. By 2000, only 30% of China's population had health insurance. The rest had to show up with money in hand. A medical consultation was roughly equivalent to a month's salary. What's more, in rural areas, medical attention left a lot to be desired. So, therefore, the Chinese preferred to go to hospitals in the city. The average week-long stay in a hospital could set you back the equivalent of 3 months' salary. In addition, China is the only country in East Asia that charges for childhood vaccines. Faced with this scenario, diseases that China once had under control have returned. This is the case with tuberculosis, measles, and snail fever. The worst thing for the Chinese is that healthcare costs them an arm and a leg, and on top of that, they have to tip the doctor if they want to be treated well.
Chinese doctor took more than $18 million worth of bribes, says report, The Guardian.
However, things have changed in the past 10 years. How? Well, let's take a look.
Himalayan VIAGRA.
When the SARS crisis occurred in 2003, the government decreed that those affected would receive free treatment. But this created a quandary for the population. How many Chinese people didn't go to the doctor for fear that theirs was the normal flu and then they'd get an unwelcome bill? If your population is afraid to go to the doctor, this is a problem for any country. Reforms of the health system that began in China in 2009 have gradually brought about changes. The main one is now that 95% of the population has health insurance. But hold on a moment, because this hasn't solved the problems either. Insurance only covers between 50 and 75% of the cost, so when the disease is severe and treatment is expensive, the Chinese have to dig deep, and not everyone can do that. In fact, China's health system combines the worst of both worlds, the worst from a fully private system and the worst from a universal care one. On the one hand, the government wants to help citizens cover the cost of healthcare, but on the other hand, they need to control public spending. So what do? Well, there are limits to the amount of subsidized treatments that hospitals can claim from the government. Approximately $1,700 per patient in the best hospitals, considerably less in rural areas. As a result, very few patients will spend more than 2 weeks in hospital, regardless of whether or not they're healthy. So it seems, whichever way you look at it, the system is inefficient. On the one hand, hospitals are being encouraged to treat their mildly ill patients to collect the maximum subsidies from the state, but on the other hand, there is little interest in caring for seriously ill patients with little means to pay the difference. And on top of that, the cost of healthcare is multiplied for the state. To what extent? Well, by about $300 billion a year. To put that in perspective, that amount is the same as Chile's total GDP, or the equivalent to the entire Mexican annual budget. As you can imagine, this is a huge mess. It's bad healthcare combined with huge government spending. So the Communist Party officials met one day and they came up with something different. And what do you think this great solution was? For this traditional Chinese medicine. And no, this isn't just something for tourists. Many Chinese continue to believe in the ancient traditions that have been passed down from generation to generation. Most of the people still rely on herbs, acupuncture, and gymnastics. In 2016, the Chinese government regulated the traditional medicine practice, and because they needed doctors, they relaxed all the requirements to be a doctor. You used to have to get a degree in conventional medicine and then specialize in other fields. Now, you just needed to know about traditional medicine and have 2 colleagues who are willing to endorse you. Yep. That's right. But hold on for a moment, because at the time of making this video, there were already more than 4,000 traditional medicine hospitals in China. You think I'm exaggerating? You think this is a conspiracy? The truth is that as far as the Chinese officials are concerned, this is far from a secret to be hidden. In fact, the traditional Chinese medicine, also referred to as TCM, is something to be proud of. Just check this out.
China now has 4,238 traditional Chinese medicine hospitals, with 877,000 beds.
The news is not from any anti-China Western imperialist outlet. This is from Xinhuanet, the official news from the Chinese Communist Party. In other words, they brag about how much they use their traditional Chinese medicine. And this is especially popular in rural areas. So, for example, some treatments include dried geckos. According to some, those would cure some types of tumors. If you have erectile dysfunction, you could try the so-called Himalayan VIAGRA. This is a mushroom that grows, you guessed it, in the Himalayan mountains. And the demand for these mushrooms has increased so much lately that 1 kilo of this miraculous natural medicine can cost more than $110,000. And I know what some of you might say. Well, there's currently a debate even in Western countries about traditional Chinese medicine. But so far, there is no clear evidence that it works. Both the British NHS and the American Secretary of Health do not advise these treatments. Then again, the WHO has included some of the traditional practices for diagnostic purposes only. We should also consider that China is a member of the WHO, and they have been lobbying for decades in order to promote TCM. And maybe some of you are thinking right now, well, they might not do anything, but I mean, they're natural remedies, they can't be bad for you, right? Well, you better think again.
Report 1/5 of China's soil contaminated. BBC.
So to give you an example, in 2013 they discovered that some rice harvested in China contained cadmium. Cadmium is an element that can cause cancer. This is just one of the many scandals. So if there is contaminated rice, there could also be contaminated herbal treatments. Think about it this way. When you release a brand new pill to the market, you have to go through lots of clinical trials. Meanwhile, the Himalayan VIAGRA comes straight from the field, so it's much harder to detect dangerous trace elements. So at this point, you might be wondering, well, what does this have to do with coronavirus, Simon? Well, get ready.
The bats are back in town.
I know what many of you are thinking. What's the problem with traditional medicine? If you don't believe in it, just don't use it. The problem is when someone turns away from modern medicine and throws themselves into the arms of a charlatan, then you get things like this.
Chinese alternative medicine empire is under fire after doctors say it gave jujube tea to a 4-year-old cancer patient. Washington Post.
The other danger of traditional medicine is ecological. For some reason, many traditional treatments require rare and endangered animals of which there are few specimens left, and then suddenly they become extremely desirable. That's the case with rhinos, pangolins, and bats. And here is where coronavirus comes into the picture.
Rapid classification of beta coronaviruses and identification of traditional Chinese medicine as potential origin of zoonotic coronaviruses.
Of course, this is just a study with a theory. You see, this is not the first time that there has been a coronavirus epidemic. SARS was also another type of coronavirus, and the original host that passed this virus to humans was a bat. The second coronavirus outbreak was MERS, one that originated in Saudi Arabia in 2012. In this case, the animal that transmitted the virus to humans was a camel, but the camel had been infected by a bat. In other words, it seems that some type of bat might be the natural hosts for some coronaviruses. And it turns out that those types of bats are used in traditional Chinese medicine. It's not yet known what caused the current coronavirus crisis. Some theories pointed to bats, others pointed at pangolin. Obviously, we at VisualPolitik don't have the answer. What we do know is there is someone influential who encourages the Chinese people to eat weird things, thinking they will cure all ailments. And he's this guy.
Xi urges enhanced efforts to promote traditional Chinese medicine. China Daily.
So why the big push from the top? Well, it all comes down to money. Because traditional Chinese medicine is cheaper, it is much more popular. According to official Chinese figures, traditional medicine has reduced hospital expenses by 24% and outpatient costs by 12%. According to Xi Jinping's narrative, what we call science-based medicine is just Western medicine. Traditional medicine is just another type. It's just as good and as bad as science. Or maybe it really is better. At the end of the day, it's Chinese. And it is 4,000 years old, after all. This must be the proof that socialism with Chinese characters is better than Western democracy, right? All of this explains China's efforts of promoting TCM all over the place. At the WHO and also in legacy media. And do you think I'm talking about fake news? Of course not. I'm talking about media outlets like this one.
Coronavirus. Can traditional Chinese medicine help fight the disease?
That headline is from Deutsche Welle, which is the German equivalent of the BBC. I mean, we're talking about an authoritative source with an undisputed reputation. And of course, Chinese official media will go even further.
Traditional Chinese medicine treatment effective against novel coronavirus, says official China Daily.
So the question is, are bat-based treatments the origin for coronavirus? Well, we definitely don't know the answer to that one, and maybe we never will. There is only one thing we can tell you. If that were true, China would hardly admit it. Why do we know that they would act that way? Well, here's a clue. Chinese
doctor silenced after warning of outbreak dies from coronavirus. New York Times.
Once again, it's up to you to form your own opinion. But it's hard to imagine China being transparent about this. In fact, they have every incentive to cover this whole crisis up with a huge dose of propaganda. Think about it this way. These last 2 years have been a nightmare for the regime. First, the Hong Kong protests, then the trade wars, and now coronavirus. This pandemic could easily become the Chinese Chernobyl. Just like Chernobyl, this is not a conspiracy. Nobody wanted the plant to explode. It was the lack of security measures and the lack of transparency that led to the reactor blowing up. Something similar could happen here. There's no conspiracy. There's no master plan. And can we really say that China has acted responsibly in this matter? Do you think the Chinese healthcare system did play a role here? And will this coronavirus have a political impact in China? Please leave your answers in the comment section below. Before we finish, I would like to thank Amjad from Globulo Azul for helping us on this video. If you want to learn more about health and you happen to speak Spanish, please do check out his channel. And please do visit our friends from Reconsider Media, the podcast that provided the vocals in this episode that were not mine, and thank you for watching.
If you want to learn more about politics and world affairs and hear some more of my lovely voice, come check out the Reconsider podcast, where we don't do the thinking for you. Find Reconsider at www.reconsidermedia.com or on Apple or Google Play or your favorite podcast.